Welcome and ahlan wa sahlan everyone. Thank you for joining us today. Our audience today is from all over the world, coming from Canada, the United States, Europe, and more. So thank you for joining us in this webinar. My name is Suha Salman Musa, and I am the Executive Director of the Mossawa Center, the Advocacy Center of the Arab Citizen of Israel. As we all know, a coronavirus outbreak continues to spread globally, and the situation in Israel is no different from any other country. So during the outbreak in Israel, we at the Mossawa Center have been leading an intense advocacy campaign to mitigate the spread of the virus in the Arab community. We have worked directly with the Joint List and the Arab High Follow-up Committee and other organizations to raise awareness about necessary precautions people must take and advocate to the government about the needs of our community. We also demanded to open testing centers in the Arab localities, demanded the health ministry to put information in Arabic on their website, and produced informative videos in Arabic about the outbreak for our community. As part of our advocacy campaign, we believe that it's very important to keep our international audience informed regarding the situation in the Arab community in Israel, especially in this crisis. So this is why our webinar today will focus in exploring how the coronavirus pandemic the recent political developments in Israel have impacted the Arab minority. I hope that we will cover many topics, if the time will allow us, ranging from the government response in the Arab community for this crisis to what Gantz's surprise alliance with Netanyahu means for the future of the Arab minority. So I'm honored to be joined today with our two panelists, Dr. Youssef Jabarin and Professor Fahd Hakim. Dr. Youssef Jabarin is joining us from Al-Fahm, is a Knesset member from the Joint List. He is the head of the Joint List International Relations Committee and a long-time lawmaker. He earned his PhD from Georgetown University and is an expert on international law and minority rights. And he has been serving in the Knesset as a member of the Hadash party in the Joint List since 2015. So thank you for joining us and welcome, Dr. Jabarin. And from Nazareth, Professor Fahd Hakim is the head of Nazareth Hospital, EMMS, and serves as a senior physician in the Pediatric Department and Pediatric Pulmonary Institute at Rambam Healthcare Campus in Haifa, and as a clinical assistant professor at the Faculty of Medicine at the Technion, the Israeli Institute of Technology. He completed a postdoctoral fellowship in sleep medicine at the University of Chicago. Thank you so much for making the time and joining us in this webinar. Before we start our discussion, I would like to just let our audience that they can submit any questions through the Q&A at the bottom of the screen, and we will get them towards the end of our webinar. So, before we dive into our discussion regarding the medical and political issues, I would like to see how have you been holding up so far?
Starting.
This is for both of you, yes.
I invite you, Professor Hakim, to start.
Oh, thank you. Well, thank you very much. First of all, thank you, Suha. Thank you, Dr. Jabarin, and thank the audience that are joining us now from all over the world. I'm sitting in Nazareth. Nazareth is the main Arab city in the country of Israel. It's a well-known city all over the world. As you said, Suha, this COVID-19 pandemic have been going all over the world. It's not, surprisingly, it's not jumping over any city or any town. It's not discriminating between tall people or short people, blonde or red hair. It's everyone. So we are actually in the same situation as you face all over the world, especially in the United States and in Europe. and we're facing the same pandemic here. Basically, we're going into kind of a challenge that was based on, as you probably know, the healthcare system all over the world, and especially in Israel, and especially where we live in the periphery of the country, wasn't that, you know, big system that was ready for any kind of the pandemic. As we can see all over the world, it's not just in Israel. Every country was hit and hit hard, even though, you know, we knew that China is dealing with a pandemic, and we had a week or two or a month or two to get ready to something that is going to hit us. Most of the healthcare systems in the world so that it won't come to us. Just, you know, close the borders and it's will be fine. But at the end of it, we're being hit. And as you probably know, all of us know today what we call the curve, the numbers that are going to go high, and everyone is trying to get this curve down. And this is what the same situation we're dealing with in Nazareth. For today, in Nazareth specifically, we have a couple of cases, like 9 to 10 cases in the city, but around us, we have almost, you know, hundreds of cases around the city, and hopefully it will stay this low, but we know that we're still not at the peak yet.
And on a personal level, how do you protect yourself?
Okay, so, you know, basically, I'm as everyone, you know, I'm a citizen. I'm myself, I'm a father, I'm a husband, I'm a son. So basically, I'm here, I'm leading a facility that is the main facility in the area from many aspects of it. We are based as a community-based hospital in the middle of the society, facing the same. I'm troubled, as you know, my mother is at home. My kids were actually quarantined a week ago and went out because at school they had visitors that had COVID-19 positive. So we're having the same problems, the same situation, and personally, it's a challenging, I can call it. It's not an easy, you know, part of our life.
So I would like to wish you to stay healthy and
Thank
stay
you.
safe. Dr. Jabarin.
Well, so again, you know, thank you and thank Mossawa for organizing this. Thank you also for Professor Hakim for taking the time as well. This is a really a tough period, probably not just in Israel, but maybe all over the world. And it touches us both on the personal level with our families around and the need to protect our families, but also having us doing our you know, our public work and our professional work, whether among our community or generally within the society in Israel. Everything has changed in the last few weeks. We were not actually prepared for, you know, for that. And all of a sudden we need you know, to do and to deal with this in a very short time, and to get ready during the development of the event. Probably everybody knows we just, you know, finished the election in the first week of March, and then we all of us got busy with you know, with this virus, and now the entire country is now busy with that. I you know, I would like to say that in one hand, you know, the virus has definitely influenced the political screen in Israel. It seems it was one of the main you know, factors that led to the probably now of the upcoming government in Israel. That's on one hand. But on the other hand, it has maybe bring most of the Arab activists and Arab NGOs within Israel to come together and to work together in order to do our best to protect our community. So while the national political development has been going through, we also in the joint list, in the national committee, of the Arab mayors in Israel, in the follow-up committee, in the civil rights NGOs like Mossawa and Adala and others. We came together in order to present one, I would say, one front to challenge the current situation and to try to serve our community in this difficult time. So it's a combination of politics, of health issues, and definitely of personal aspects as well. And I guess we will have time to address these issues during this conversation.
Thank you so much. And yes, we will address all these issues and what the joint list did and what also the medical staff is doing. But on personal level, how you are taking care of yourself. I know that you are all over, from one place to another. So
yeah, I mean it's really difficult because I have my mom living not near my family. I have my kids around, but at the same time I have to do my public work, so I go a lot outside in the Knesset in Jerusalem, in Tel Aviv, meeting people. As much as I could, within the limits of the current situation. So personally, I try to adhere to the safety guidance on this part and doing our best. However, I know, just as Professor Hakim knows as well, that we are taking the risk, and as public servers, we know that this is an integral part of our work. So we do that, and maybe we are also lucky to be in this position to serve our community and to serve the society during this really challenging time.
So I wish you to stay healthy and take care of yourself because we need you.
Thanks.
I would like also to address Dr. Hakim regarding what you said about Nazareth. You are the director of the largest hospital in Nazareth, which is the largest Arab city in Israel. Could you tell us what have you been experiencing so far in Nazareth regarding the outbreak? I know you mentioned that there are less numbers of infections in Nazareth, and it's remaining low, despite it being very densely populated. So what are being done there, from point of view of the hospitals and also, the community? And this also, a question is also for you, Dr. Jabarin, but I would like to get from the medical point of view, and also from you, as you said, you are trying to cooperate with other organizations and activists to mitigate this spread of the virus. So, Dr. Hakim, please.
So basically, as mentioned by Dr. Jabarin, it's what we're looking at as a minority. Let's start with what is the importance of being a minority, and sometimes minorities become much stronger through those challenges. Most of the Arabs in Israel live in the periphery of the country, and the periphery of the country lacks healthcare system services before this outbreak have been coming to Israel or to the world. And we know that hospitals in the area before that lack services, and with the help with MK Jabarin and other MKs from the journalists, we've been struggling together to give the hospitals in Nazareth more and more support. And as you probably know, we are a major city, and what happens to Nazareth basically spreads everywhere in the north of Israel mostly, and on the Arab side specifically. When the outbreak came in, at mid-February, the first patient in Israel came in, the Ministry of Health basically put most of its power, or all the system was working in the mid of the country, in Tel Aviv, Jerusalem area. And the periphery of Israel, north and the south of it, lacked the system that wasn't ready to get the virus. And basically the Nazareth hospital was the first actually to take over this activity of translating most of the regulations that came from Ministry of Health, on our website, on our Facebook, and then joined by much of the leaders. And this is the amazing part, Suha, that we can see that more and more leaders out of the public health and not public health coming together to join together to face this enemy. As it is, we are one joint list, actually, not just basically in the political side. And we can see that we may now know that in Nazareth, most of the members of the staff are Arabs, but in whole Israel, we have some areas that are 40 or 50% of the staff in hospitals coming from the Arabic sector. To this day, that means there is, the Arabic sector is much more represented in the healthcare system than it is even in the political aspect of it, or even in the community base. We are 21% of the community. So this is the time that as a healthcare, as Arabs, we are actually raised to be very important in the healthcare system, and again, in facing this outbreak together with the whole country. In Nazareth specifically, I think, as it is a very holy city, and as you know, we have 3.5 million tourist visitors that come to the city every year. So this year, we don't have those 3.5 million people coming from abroad because it's closed. Now we are in Easter time, and the city is like really, it's locked in. Everyone is in houses, and we had Palm Sunday yesterday. It was, it was devastating to see the holy city closed. But I think Nazareth specifically, because of having the first tour of tourists that came in, and we had, even before the outbreak was felt in the country, we had I call it signs that it's here. So we had the first tourist group, and people were shocked. And 2 weeks later, we had another tourist group coming from, the first one was from South Korea, the second one came from Italy, and others. And again, so basically we had the problems, and again, our school, my kids' school, 1,000 kids quarantined one day because a tourist or some lady came into the school. So people were afraid and actually came into the houses and locked themselves in. And I think this is one of the things that made Nazareth a little bit safe for the time being. But still, and I think, Dr. Jabreen will comment on that, we still I don't see the reality of what's happening in the Arabic sector. Because we know Arabs have more chronic diseases, have more smoking. We talk about 50% of the Arab men smoke. So these are risk factors for the COVID-19, people to get infected in. We don't have too much elderly patients, but our people in the 50s, their metabolic age is more like 70s here. So we are in a risk, being in an area that lack services, being at risk, make us would be suffering. And again, maybe we're lagging behind what happened in the center of Israel, and hoping that we're staying low numbers. But we know that the truth will come in the next coming 2 weeks.
So I would like also to follow up on what you are saying, that this is a joint effort for everyone. A joint, if you call it joint list, not only in the political side. So I would like to, if you can explain, Dr. Jabreen, what the joint list has been doing to help mitigate the spread of the virus in our community.
Yeah, I would start first with maybe the general challenges, and I would say that the crisis, the health crisis, has revealed maybe 3 levels of national challenges that we have been facing. And I would say that these 3 levels actually represent the historical challenge that the Arab community has been facing, and today we are witnessing that specifically in the current crisis. The first one is the absence of decision making. Arab professionals within the decision-making circles. That happens in maybe all of the decision-making circles in Israel, and we have witnessing that now during this crisis, that on the national decision-making on the crisis, definitely in the government, but even within the health ministry itself, there are no representation of Arab community professionals definitely not politicians. But speaking on the professional level, we are witnessing this, this lack of leadership. We have a lot of experts, of leading experts. Definitely, Professor Hakim is a leading expert here on the national level, not just within the Arab community. And we wanted to see people like him within the leading team of this crisis. Definitely comes with issues related to the Arab community. Unfortunately, that has not been happening in general in terms of incorporating Arab decision makers, but also is not really happening now in leading this crisis. And instead of inviting people like Professor Hakim and other, and to build a staff of professional, Arab, to work with the government on these issues, we are witnessing basically continuing process of excluding them. That's maybe the first level, the lack of Arab representation within the professional decision-making circles. The second level is the fact that governmental services so far are not available in Arabic in many of the major areas. And when Arabic is provided, it's provided like maybe a day or two later. Although this is like a very emergency issues, it need to be just immediately published. Many of the important services, the health services around this time is still in Hebrew and not in Arabic. And that doesn't make any sense in a country where you have about 2 million Arab citizens and Arab residents, about 20% of the community under emergency situation. I think it's clear. It's that all of the governmental services and activities should be in Arabic. This is not happening, and that has been also a challenge that all of us have been dealing with. The third level is basically the discrimination that has been going on against the Arab community in the health area. Professor Hakim maybe has mentioned the inferior socio-economic status and the inferior health status of our community, and we are this is definitely important around this time. But it's also the fact that in the Arab communities there are even not one public hospital. All what we have is the three privately owned hotels in Nazareth. Muslim is leading one of them. They don't get funding from the government, only few funding in the last few years, which is definitely not enough to keep these hospitals. So there has been a lot of challenge among these hospitals to try to survive under previous challenges and definitely under the current one. This is a situation need to be changed, of course, and maybe the crisis will teach people under decision making in the health ministry, but in the government as well, that healthcare within the Arab community need to be upgraded, and the three hospitals in Nazareth need to be supported and funded just as any other public hospitals, because they are doing the work that public hospitals were supposed to do around this time. As we also mentioned that in the beginning of this crisis, we were worried that tests are not being conducted within the Arab localities. During the last week, that has changed. Not enough, but there is a progress on this area, and that because mainly of the pressure of the Arab community, of the joint list, of the professionals of Arab civil society who have been pressuring all the decision-making circles of the government to conduct these tests within the Arab community. Today, I think we have reached about 10,000 tests among maybe 120. it doesn't reflect still the general percentage of the Arab community. We still need more tests to be conducted, and we are working in that. And unfortunately, when it comes to the three levels that I have mentioned, the lack of Arab representation in the decision-making circles, the lack of services in Arabic at the same level and at the same time, and the fact that the health services within the Arab community are still inferior. I think these are three challenges that would remain with us even after the crisis.
To add what you were saying about the challenges, Haaretz newspaper, published on Sunday regarding the testing that according to the statistics, only about 6,500 people in Arab communities were tested, in contrast to more than 80,000 in Jewish communities. But now you are telling me that as for today, the number of the testing is up now till 10,000. So I'm pretty sure
we are around 6 to 7% of all those who were tested are Arabs. It's the percent around 6 to 7%. It's still relatively lower, way lower than the 20% that we constitute among the community. That means that we still need to do a lot of work to be sure that that we understand the entire, and that no hidden disease among our community without a sufficient reacting. So this is the percentage so far: 6 to 7% of all tests within the Arab community.
Before we go to the political issues and to deal with the upcoming reforming the government, I would like to ask Dr. Hakim, given what Dr. Jabreen is saying, especially with the lack of testing, because this is very crucial in all over the world and here in New York also. I would like to maybe give me your thoughts about how you can locate those who had been in contact with COVID-19 patients in the Arab community, and how you can, or have you been tracking the outbreak because of the lack of this testing? Is it doable? Can you locate this carrying of the virus?
It's a major question, and actually this is something that we have been struggling with since the COVID-19 outbreak came into the country. And as Dr. Jabreen said, the lack of facilitating the option to come and be tested was obvious. And again, with the help with Dr. Jabreen and others in the MKs and joint list, and then pushing, what we have been doing as professionals, we were like looking for the gaps that are facing our minority. And Dr. Jabreen and myself, we talk as, on a daily basis. Sometimes it's more than 4-6 times a day, because we reflect what we are doing into the ground, and they reflect, pushing the ministry and pushing the regulators. And as he said earlier, we are not sitting into the head team that leading this, but we are trying to actually not say, okay, we're suffering, we don't have. At the end of it, people will be dying out of that, because it's not just a test you're going to fail. And very important as leaders at this point to be coming with the solutions, not just with the problems. And this is what's been happening with Dr. Jabreen and others. And again, we're facilitating. We're saying, okay, we need to be tested, so let's give them the land, let's give them the resolution. Just give us the the support of the techniques that we're needed. And I think the Ministry of Health at this point went into a kind of changing the terms of being got to be tested. Like if you had the symptoms, you had to be like in contact with somebody that came from abroad to be really tested. And this was a major problem, that most of the society around us weren't abroad and weren't actually in contact with those people. So nobody went to be tested. And actually we didn't have where to be tested, because it was just, contacting what we call the MADA or the ambulance care Israeli ambulance care. So this like team has to come to home, and no people called, even with the numbers of callers, we had like a very extreme numbers that we're talking about 7,000 a day out of the whole country, and 100 or 150 people from the Arabic society calling. So, or even less some days. So this was the uniqueness of, we lack those actually testing areas. And today we have them more. And I think what we should be doing is probably going active on this measure, looking for the people, not waiting for the people to come and to be checked. Go to every village, go to every city, actively check or screen some areas, neighborhoods, and start out of that areas to get more and more the map of the realistic problems that are facing us on the ground. One aspect that is actually problematic on our side is people have been looking at COVID-19 patient as let's call it, it's a shame, some kind of, a major problem that facing those patients that like people have been giving him shaming. So people are afraid to come and be tested, even not just in the Arabic community, all over, but basically more in the Arabic, I'm not going to be tested because it's a kind of a disease that gets you to be in a specific problem. And myself and Dr. Jabareen, we went out with videos to explain to people that it's not a shame to be tested. It's a shame to sit at home and not to be tested, and you have the virus. And we saw that people actually came more into testing, and the last couple of days, I can see in the hospital itself, we're performing today, in one day, the number of the tests we performed in the last 3 months together. So it's have been some kind of a change in the minds of the population. People are coming to be tested more and more. And this is very obvious for us that will give us a good start to the next step, actually, of locating where the hubs. And this is something important, again, in the Arabic sector. We see it totally differently than what happened in the Jewish sector. The Jewish sector is actually personal, one person. In the Arabic sector, we see them as groups, families. We can see that in Nazareth, 7 people coming from the same household, the same family. Okay, in Tamra, the same. In Fahim, it's becoming the same. So it's not a spread. It's basically hubs that we have into our cities and our villages. We need to take over those and close on them and keep it in the same house. And this is very important. A couple of days ago in the media, they said, you need to be like joining just the family members. So family member, when you say in Arabic family, we have sometimes big families, like 700-800 people. You're not joining a family. You're joining household family. It's the same people that you live with. You can't just Jabareen family, get them together. This is not a truth that we want to be happening, right?
This is a major issue that, first of all, the testing and the isolation of the people that have the coronavirus or tested positive for it. But I think I would like to add one of the successes that happened regarding testing people that are coming from abroad is with the students. And Dr. Jabareen, you can also add here, because people or students that came from Italy, from Jordan have been tested, and the people or the students that have been tested positive, they were isolated in centers or in hotels so that they cannot get or be in touch with their families or big families. I think that this is one of the successes that have happened because of the joint efforts of everybody, including the organizations and the joint list, for demanding this testing to be done. And also for you said about the testing and about the isolation of the testing of who is already tested positive. I think that we had some issues with certain communities that they didn't have any places to put the people that are tested positive in these hotels or centers. So I think that also this is an ongoing work for everybody, including the joint list, to have solutions for these people in order to really give them the place, the appropriate place to be in order to get over this 14 days or the period of time that they have to be isolated. I know it's
on that
yes.
on that point, I think that as I said, the crisis has has arrived right after the election, and the people were very motivated in the election, and they actually continued with that during the crisis, in the meaning that they have looked at us in the joint list as as their supporters, as as the address for their problems, especially when in cases with the uniqueness of the Arab community. And one of the leading example indeed is, for example, students who are studying abroad. When I mean abroad, that includes Palestinian universities in the West Bank, thousands of Arab students in Jordan, but also in Europe. Among all of the students from Israel who study abroad, about 50% are Arabs. Our estimation that they are about 20,000. And we had to deal with all these issues of bringing them back, and then the issues of testing, especially for those coming from Italy and from Jordan. And when they are now here, there's also a lot of economic questions, how to deal with what support they could get from the government, because in fact they're on the radar of the Israeli government. One example of the issues that have come up in the last weeks is the issue, for example, that a student in the age of 15 and 20 students or youth in Israel, they are not entitled for unemployment allowance in Israel. And we argued this definitely discriminate against Arab youth, because they are the ones on this age who go to work, and then now they cannot work. They need to get unemployment allowances. However, they are not entitled to because of the law, and we are trying to address this issue. So this is one of this example. Other example relate to all the difficulties that we have been witnessing in the area of education. The Israeli system, like many other systems in the world, have moved to learning from distance, basically learning from home. And we have realized that there is a serious issue among Arab pupils. Our estimation is that over 50%, over 40% of Arab families, they cannot really learn from home, whether because they are lacking the needed technological devices, mainly laptop and these machines, or there is not enough infrastructure for the internet, or sometimes for even electricity, especially in the south. So that has become a really problem. And actually, we, with the help of civil rights NGOs, they have petitioned now the Supreme Court, asking for the intervention of the Supreme Court. We have the number of over 100,000 Arab pupils. Again, it's over 100,000 Arab pupils who cannot really exercise, learning from home, and they are denied basically right to and study around this time, and that has been a major issue. So maybe the point to emphasize here is that we in the joint list has become the address along with the Arab mayor and the Arab civil society to to address all these issues. They are not really health issues, but they are definitely directly related to the health crisis that all of us are witnessing.
I can't agree more.
I want to elaborate that. So if you please, I think really the Knesset members have become, the hotline of every citizen that needs help. And I think, God help you, Dr. Jabrin and others. It's really a hard time for them, dealing with all the situation, as you probably understand. It's not just a health problem. It's a major socio-economic problem, educational, on the basics of finance and the basic of health and any other basics. And just imagine 20,000 families calling to know what's going to be happening with their families. And really, we can see that this is the leadership that we're being here. And I can tell you that Dr. Jabrin, I call him sometimes in the middle of the night, and he's there all the time. And thank you for that, Yusuf, for helping us every time we are calling you.
We thank all of you for all the hard work that you are doing, and among other organizations and activists, as you mentioned, that this is really a joint effort for our community to get over this pandemic and this crisis, because I think we know that when we would like to accomplish something, we can do it. For example, the 15 Knesset members for our community. So I would like now to pivot to another crisis happening, and this is very important issues that we are addressing, but we only have 15 minutes now, and I would like to talk about the political crisis, because I need to take questions from the audience, and there's a lot of questions. I hope that I can address all of them, but I would like also to ask you about what is the political crisis that resulted of the third national election and the third deadlock. This time, the Joint List had another strong showing. The election resulted in another deadlock among the Jewish parties, deadlock which could have been broken with the support by the Joint List of either of the Jewish blocs. So, Dr. Jabrin, could you please explain to us what happened in the aftermath of the elections? More specifically, could you also discuss how Gantz betrayal of his voters by joining forces with Netanyahu, and how will impact the political landscape in Israel, and especially what that means for the future of Israeli government and for our community? I know it's large question, but I count on you that you will address it.
Yeah, we will need another round, round of
so maybe
in order
yes.
to address issues. But in fact, as we have been witnessing in the last 2 weeks, it seems that there is progress in the negotiation to establish a government. Gantz spent a lot of his campaign speaking of he and Kahol Lavan being the alternatives. They cannot sit with Netanyahu mainly because of the indictment against him for corruption, for his dividing approach of the Israel society, for his also incitement and etc. And all of a sudden, all of that has disappeared, and Gantz was even ready to divide his own party in order to get into this coalition with Netanyahu. What I want to emphasize here, I don't see that this is a unity government. I think that this is a pure right-wing government. It seems that Yamina, the extreme right-wing party, at some point will be a part of this coalition. It seems that the supportive of the deal of the century plan of the American administration annexing settlements to Israel, which I think this is a very dangerous step. So basically, it's going against all of the promises that we heard from Gantz during the election, although he had 61 or 62 members of the Knesset that would vote against Netanyahu in the Knesset. He didn't use that, and this is definitely unfortunate. But that just raises our responsibility now in the opposition, maybe also with the Yesh Atid. It seems that they will be the main opposition together with the joint list to present the alternative for the Israeli public, and to emphasize that the only alternative could come through recognizing the right of Palestinians for self-determination, for a Palestinian state alongside Israel on the 1967 borders, the issue of full equality for Arab citizens. These are the main issues that we work with, and definitely, hopefully, after this crisis, definitely will be the main issues that we will be basically presenting. It seems that Gantz and Netanyahu are going for this government. It's not clear what would be the price, but the more Netanyahu, I think you win time in the coming few weeks. I think the weaker would be Gantz now, and that just emphasize what I have been saying, that that all of what Gantz is doing these days go against his promises to his audience. This is, again, it's not a good news for peace supporters, for equality supporters in Israel. For us in the joint list, now that we are 15 members, we feel more self-confident, and we feel that we are stronger now to deal with all these challenges. And for us, that scenario was one of the scenarios that we definitely expected, and we will continue to support and to present and protect the causes of equality and peace as as the leading of the opposition now in Israel.
Of course. I would like to start now. I know I have much more questions to ask you, but time is ticking in, and I only have 10 minutes to end this for the end of this webinar, and I would like to take some questions from our audience. So Dr. Jabarin, this is a question for you from our friend and supporter Rick Robbins. He's asking, Dr. Jabarin, would you comment on how the political parties reacted to the success of the joint list in the recent elections, specifically as to the willingness of either party, Blue, White, and Likud, to accept the support of the Arab parties in light of the inability of either party to form government without the support?
Well, when it comes definitely to the Likud and the right wing, I mean, all their campaign was against the joint list and against any political role that we could play. That was the clearly racist campaign that says that the joint list cannot be part of any political decision making. And all of us remember when Netanyahu, after the election, when he made the calculation about the result of the election, he didn't even count the 15 seats of the joint list. Within the Blue and White, I would say that we saw a lot of internal discussions there. Some of them said that this is not an option at all, and some of them were ready to go ahead and to open some kind of negotiation with the joint list for the first time, maybe in the last decades, or maybe since the Rabin government. We held maybe a couple of negotiation meetings between the joint list and the Kahol Lavan. That was important for us in any way, because we wanted to present our demands, our issues. All of them are human rights and civil rights demands. But as I said, unfortunately, all of this stopped at once there was this news about the new development between Gantz and Netanyahu. However, we are in the Knesset still now working with the temporary committees, parliamentary committees that were established, including one committee headed by the joint list, which is the Working and Work and Welfare, Labor and Welfare Committee, and that has been also a good achievement for us. There are also the community on the violence within our community. There is a subcommittee on the issue of the coronavirus, a subcommittee on in the economic level. So to say that at this level there are already have been some achievement, I hope that being the third party will enable us also to lead some of the parliamentary work and parliamentary committees, even under Netanyahu-Gantz government. But that is something that we will see after this the establishment of a government, if things go ahead with Netanyahu and Gantz.
And we have another question from Stefan, your friend, Dr. Hakim. He's asking, those in the medical field and across the community, how do you ensure that those in the medical field and across our community get the sufficient distribution of equipment like PPEs, ventilators, personnel, and other needed items to combat this horrible virus and ensure a no return to COVID-19? I think both of you can answer this, but
Okay, so first of all, thank you, Stefan. Stefan is our ambassador of the Nazareth Hospital, joining lots of ambassadors all over the world. And say hi to Therese. I know that she's joining us too. But yes, again, Nazareth Hospital, as it is, as a hospital in Israel, we demand for support. The public is demanding for support, and we're actually gaining the support that we need. You know, on the MKs are looking at the situation. They're helping us to push. And as the Knesset member Jabarin knows, the country here, the Ministry of Health is opening the doors. And if you knock the doors hard, you can get there. It's how did you deal with the situation? It's not just sitting at home and saying we didn't get, we don't have. You need to push, and you push hard, and we're doing that. And actually, we're getting the support. It's obvious that today in the Nazareth Hospital, we actually prepared 3 sections and wards for the coronavirus patients. We call them the Victory departments, the Victory 1, Victory 2, and Victory 3. And actually, they were supported by the Ministry of Health in Israel to be with equipment and with the techniques that needed, as it is in any hospital in the world. So basically, we are working hard. While we're talking, we got a lot of masks and more of clothing for the staff coming from the stores that are around us. We're buying too many things, and we're getting things again from the Ministry of Health too, and from the support of the supporters around us. It's a time of, amazingly how to see how many people want to support healthcare, and we're getting even budget-wise. It's open all over the world. We're getting budget from everywhere, countries in the world, people that are feeling that they want to be a part of this situation. As Dr. Jabrin said, every one of us could do something and do a change. He's a Knesset member. I'm a head of hospital. You and Mossawa, any other guy, anyone in the world can join us today to fear and to be like fighting the virus together. So Stefan, don't worry. We're keeping the people around us safe, giving them the support. Even municipalities are going around giving masks for elderly people at houses, giving support, some hot things and food, basic things to the citizens around us. And from the hospital itself, we're sending out our staff to take care of people at home. A hotline is open. If anyone needs anything supportive by telemedicine today, we're supportive of the community around us and hoping to make it more and more efficient in the coming days.
And related to this issue, there's a question also from our friend Ramin Ser. He's asking, can you reach out to the European governments or organizations to provide the testing or any other supplies?
The problem with the testing is not just the part of making the test. It's the reagents, it's techniques, it's equipment. And the problem is worldwide. When you talk about gene expert devices, it lacks not just Israel, it lacks all over Europe. The countries are looking for those devices, by one and one. And today, the thing that is a kind of a change that China today is the one who is supporting the other countries that are now into the outbreak itself. So basically, yes, we're going to the European countries. We're asking for help from anyone that can give help. But as you know, Italy, Spain, other countries, even England and the UK, they are into the outbreak as it is, as we are dealing with it here, the same.
I have another question. I'm sorry, yeah.
No, on that, in facing this challenge, to say that our strength as community is in our cooperation on the leadership level. And when I say in the leadership level, I see this cooperation between the political leadership, but also the professional leadership, civil society, and the local leadership. And you know, when you have people like Professor Hakim leading, you know, the health efforts in his own hospital, but also in Nazareth and on the national level, we feel more confident that we are, you know, we are able to pass this challenge, and we have when we are able to protect our community. And and as I said, you know, in the beginning of this interview, that this crisis has helped us to come together and to develop a joint working, you know, relationship, and this is definitely important, and this should be also positive and constructive also for the long term. And we build, you know, we build our own capacity so far within, you know, within Israel and vis-a-vis the Israel decision-making centers, but maybe that also will help later on to work also as a joint community vis-a-vis the entire international community as well.
And there's a question I think you already answered from our friend in Canada, Shawqi Fahel. He is asking, has the joint list in the level of political and professionals from the healthcare had established a committee to deal with this unexpected crisis to deal with the COVID-19? And as you said, and you can explain more if you would like, that there's a joint effort, but he's asking specifically if there's a committee that was established.
Yeah, I mean, there's, you know, we're going to join this 4 parties who establish a health committee headed by Amki Ahmad Tibi, represent, you know, working in the area of the health. There is also like an umbrella committee, an emergency committee within the National Committee of Arab Mayors and the follow-up Arab community and civil society. So there has been of self-organizing efforts in the last few weeks, and we are doing our best to coordinate these efforts. And as I said, our strength would be really in you know, pushing together toward protecting our community and you know, doing our best to pass this crisis with minimum maybe damage for you know, for the community.
Well, I just would like to you know, to emphasize that during this our discussion and the answers that you have provided, I can see that our community can learn a lot of this crisis. As you said, on the political level and on the medical and healthcare level and on the community level, that we can join forces together, we can beat this virus and this crisis. And I think we are doing a great job, and to get over this, despite all the discriminations, despite all the challenges that you have mentioned, both of you, I think we are all doing a lot to our community, and I think that will affect in a positive way after we get over this crisis. And this is something that we can learn, all of us, how we can deal with these crises. So I think we are getting to the end of our webinar. I would like to thank everyone who joining us and taking a part of this special thank for you, Dr. Youssef Jabarin and Professor Fahd Hakim, for coming in and providing all the information. I know there's a lot of questions that we haven't addressed yet, but maybe we will have another webinar to deal with the specific issues, but I think that we have a clear picture of what it's like in Israel, what is the challenges and the successes that the Arab community is facing and overcome this crisis. I hope everyone that enjoyed this webinar and found it very informative. So I would like to wish you, all of you, especially Dr. Jabarin and Professor Hakim, to stay healthy, stay safe, and take care of yourselves. Thank you so much.
Thank you.
Thank you. Yeah. Bye-bye.